I am sure you have heard the word HIPAA. It stands for Health Insurance Portability and Accountability Act of 1996. Well, did you know there are some proposed changes to the HIPAA rule? If you are involved in healthcare at any level, yes, even a consumer, for example, a patient, then this information is for you. Stay with me until the end and I will share how you can comment on the proposed rule and make your voice heard. Hey there and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've transformed hundreds of students to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Before we get into the proposed modifications, the Office of Civil Rights, or OCR, at the U.S. Department of Health and Human Services, or HHS, announced a 45-day extension of the public comment period for the Notice of Proposed Rulemaking, or NPRM, to modify the HIPAA privacy rule. The 45-day extension moves the current deadline for the public to submit comments from March 22nd, 2021 to May 6, 2021. So you have a couple of weeks to weigh in. Now, normally this is the part of the video where I would invite you to our monthly Q&A, but April's monthly Q&A is full. So check out our next week's video for our upcoming Q&A sessions. Remember, seats are limited and it is a first come, first served. Briefly, the proposed changes to the HIPAA privacy rule include strengthening individuals' rights to access their own health information, including electronic information, improving information sharing for care coordination and case management for individuals, facilitating greater family and caregiver involvement in the care of individuals experiencing emergencies or health crises, enhancing flexibilities for disclosures in emergency or threatening circumstances, such as the opioid and COVID-19 public health emergencies, and reducing administrative burdens on HIPAA-covered healthcare providers and health plans, while continuing to protect individuals' health information privacy interests. More specifically, the department proposes to modify the privacy rule to increase permissible disclosures of protected health information, or PHI, and to improve care coordination and case management by adding definitions for the terms electronic health record, or EHR, and personal health application, modifying provisions on the individual's right of access to PHI by strengthening individuals' rights to inspect their PHI in person, which includes allowing individuals to take notes or use other personal resources to view and capture images of their PHI. Shortening covered entities' required response time to no later than 15 calendar days. Currently, it's 30 days, with the opportunity for an extension of no more than 15 calendar days. Again, currently it's 30-day extension. Clarifying the form and format required for responding to individuals' requests for their PHI, requiring covered entities to inform individuals that they retain their right to obtain or direct copies of PHI to a third party when a summary of PHI is offered in lieu of a copy. Reducing the identity verification burden on individuals exercising their access rights. Creating a pathway for individuals to direct the sharing of PHI in an EHR among covered healthcare providers and health plans by requiring covered healthcare providers and health plans to submit an individual's access request to another healthcare provider and to receive back the requested electronic copies of the individual's PHI in an EHR. Also, requiring covered healthcare providers and health plans to respond to certain record requests received from other covered healthcare providers and health plans when directed by individuals pursuant to the right of access. Limiting the individual right of access to direct the transmission of PHI to a third party to electronic copies of PHI in an EHR. Specifying when electronic PHI or ePHI must be provided to the individual at no charge. Amending the permissible fee structure for responding to requests to direct records to a third party and requiring covered entities to post estimated fee schedules on their websites for access and for disclosures with an individual's valid authorization, and upon request, provide individualized estimates of fees for an individual's request for copies of PHI and itemized bills for completed requests. Amending the definition of healthcare operations to clarify the scope of permitted uses and disclosures for individual level care coordination and case management that constitute healthcare operations. Creating an exception to the minimum necessary standard for individual level care coordination and case management uses and disclosures. The minimum necessary standard generally requires covered entities to limit uses and disclosures of PHI to the minimum necessary needed to accomplish the purpose of each use or disclosure. This proposal would relieve covered entities of the minimum necessary requirement for uses by disclosures to or requests by a health plan or covered healthcare provider for care coordination and case management activities with respect to an individual, regardless of whether such activities constitute treatment or health care operations. Clarifying the scope of covered entities' abilities to disclose PHI to social service agencies, community-based organizations, home and community-based services providers, and other similar third parties that provide health-related services to facilitate coordination of care and case management for individuals. Replacing the privacy standard that permits covered entities to make certain uses and disclosures of PHI based on their professional judgment with a standard permitting such uses or disclosures based on a covered entity's good faith belief that the use or disclosure is in the best interests of the individual. The proposed standard is more permissive in that it would presume a covered entity's good faith, but this presumption could be overcome with evidence of bad faith. Expanding the ability of covered entities to disclose PHI to avert a threat to health or safety when a harm is serious and reasonably foreseeable, instead of the current stricter standard, which requires a serious and imminent threat to health or safety. Eliminating the requirement to obtain an individual's written acknowledgement of receipt of a direct treatment provider's Notice of Privacy Practices, or NPP. Modifying the content requirements of the NPP to clarify for individuals their rights with respect to their PHI and how to exercise those rights. Expressly permitting disclosures to telecommunications relay services, communications, or TRS, assistance for persons who are deaf, hard of hearing, or deaf-blind, or who have a speech disability, and modifying the definition of business associate to exclude TRS providers. Expanding the Armed Forces permission to use or disclose PHI to all uniformed services, which then would include the U.S. Public Health Service Commission Corps and the National Oceanic and Atmospheric Administration Commission Corps. Lots of these modifications are really about you as a healthcare consumer. So be heard. Your voice matters. Comment. I hope this information was helpful for you. If so, please share this video link with your friends and family on your social media platforms. You have learned about HIPAA, and you have also learned that there are proposals underway to change the current rule. And lastly, you have learned that you still have time to comment, as the comment period has been extended until May 6, 2021. Question of the day: was this information helpful for you? Also, did you learn something that you can apply? Let me know your responses in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, smashing that subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or asking a question or even a suggestion of topics. You can also give me a little love by sharing this video on your social media platforms. Let's stay connected and connect others. Oh, before I sign off, here's the information on the how. You may submit comments to this proposed rule identified by RIN 0945-AA00 by any of the following methods. First, the federal e-rulemaking portal. You may submit electronic comments at www.regulations.gov by searching for the docket ID number HHS OCR 0945-AA00. Follow the instructions at www.regulations.gov online for submitting comments through this method. You can also go through regular, express, or overnight mail. And you may mail your comments to the U.S. Department of Health and Human Services, Office for Civil Rights. Attention, proposed modifications to the HIPAA privacy rule to support and remove barriers to coordinated care and individual engagement. NPRM. RIN 0945-AA00. Hubert H. Humphrey Building, Room 509F, 200 Independence Avenue Southwest, Washington, D.C. 20201. Now, I know that was a lot, so see the link in the description box for the details. Thanks for staying with me to the end, and remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.